Welcome. Thank you to those of you who are joining us live today. My name is Toria Hurd. I'm working with the Research to Policy collaboration with Dr. Taylor Scott, the Associate Director and Research Assistant Professor at Penn State. So to give a little background, together the Research to Policy collaboration team works to identify legislators' current policy priorities and engage researchers in rapid responses aligned with policymakers' goals.
Hi, everyone. Thanks so much for being here. We really appreciate everyone's interest in this event. This is intended to be a timely conversation. It's important to policymakers because that's our primary goal at the Research to Policy collaboration. So today we'll be addressing the rise in fake news around COVID-19 pandemic, and we'd like to see what people are most interested in learning about from today's discussion. So we're gonna start with a quick poll question. The poll question is, what are you most interested in learning about today? And while you guys are answering that, Toria, you wanna get started on our bios?
Yeah, sure. I'll actually have the panelists introduce themselves. So maybe Vish, would you like to start us off? Oh, you're on mute still.
Wonderful. Thank you for having me. My name is Vish Vishwanath. I'm a professor here at Harvard School of Public Health and the Dana-Farber Cancer Institute, doing research in health communications.
Thank you. Regina?
Hi, I'm Regina. So my specialty is how we can communicate data in a more human way and how we can not fool ourselves with statistics. Since 2006, I've been a science journalist and a professor of statistics at Gallaudet University, and I'm currently the senior advisor for stats communication at the American Statistical Association. And one interesting fact about me that I'd like to share, I'm actually deaf and I wear a cochlear implant. And I tell you this so you know, and I'm proud of it, but it also, I think, explains why I feel like clear communication is so important, because I've never been able to take it for granted, but I don't think that you need to be deaf in order to really appreciate the value of humans communicating with one another. Thanks, glad to be here.
Thanks, Regina. And Matthew?
Hi, everybody. Thank you so much for inviting me, and thank you all for attending this. My name is Matthew Faciani. I am a postdoctoral researcher at Vanderbilt University. I work in the Medicine, Health, and Society department there, and I study health and social networks, misinformation, and different aspects of political polarization as well. So I'm excited to talk with you all today.
Well, thank you so much for being here. We really appreciate you guys joining us to discuss these important issues, particularly around communication of the COVID pandemic. So I see we've got some responses to our poll, and thank you guys for responding. It looks like we've got about a third of folks here want to learn more about how a scientific consensus is reached, and pretty close runner-ups are how to communicate science effectively and how more efficient teamwork between policymakers and scientists could be achieved. We've also got a couple of people interested in the common ways that data might be misinterpreted. Thank you so much for participating in the poll. That really helps us to kind of fine-tune our focus today. So I also wanted to do a couple of notes on housekeeping before we get started. Please note that the Research Policy Collaboration is a nonpartisan entity and independent. We emphasize the use of empirical evidence in policymaking. As such, we will not discuss political questions or things that are irrelevant to the focus of this panel. We encourage respectful audience participation through our Q&A feature of this panel. You can find that at the bottom of the Zoom screen. We also use polls throughout, as you've already experienced. You can thumbs up existing questions on the Q&A menu, and we'll try to prioritize those that are popular. You'll also be able to enable captions during today's meeting using the Zoom menu for live transcripts. Now, let's get started with another poll question about your biggest concern regarding COVID-related fake news.
So as we know, conflicting opinions and fast-spreading misinformation regarding the COVID-19 pandemic has made it really difficult for the public to distinguish between reliable factual information and fake news. And while scientists and health officials are striving to understand the coronavirus and develop vaccines, therapeutics, and diagnostics to protect individuals and communities, limited and potentially contradictory evidence makes coming to a scientific consensus more difficult, and this can lead to increased uncertainty that may manifest as heightened vaccine hesitancy, extreme distrust in the government, and even abandonment of practices that can save lives. So Taylor, what do we got? What are we most concerned about?
So it looks like, sorry, it jumped around a little bit. It looks like the vast majority of folks are most concerned about the efficacy of prevention, intervention, and treatment efforts for COVID-19. We've got several people also interested in the trustworthiness of the science, as well as the individual responses to advice from public health officials, and another person who's interested in the public perceptions of government.
Awesome. Okay, so given policymakers' roles in discussing factual evidence to alleviate the public uncertainty and the concern around this pandemic, today we are going to address not only what is contributing to the spread of information and the consequences of that, but we're also going to really talk about the strategies to combat that so that we can get effective communication around there in light of the state of the science. So why don't we go ahead and jump right in then, and I will turn the conversation over to Vish first. Vish, maybe you can give us a quick background description here of just kind of what misinformation is in this context, what kind of misinformation we're seeing, and some consequences of that.
Sure. As I was saying earlier, we have to distinguish between misinformation and disinformation. And the way some of us have been defining this is that misinformation is, getting your facts wrong in general, and that is not uncommon. It is not unique to COVID-19, whether it is cancer or, flu or cardiovascular disease. Misinformation is not uncommon, and people do get certain facts wrong, I think, and that's reasonable. But as opposed to that, there is disinformation, where you're actively spreading falsehoods very deliberately with the intention to mislead groups of people. And so that's, it's worth distinguishing those two, because they have different solutions, in some ways. What we are increasingly learning is that, number one, I think unlike in other pandemics, and we have experience with, starting with SARS and going on to Ebola, MERS, and H1N1, this pandemic is very different because of the penetration of social media. And what is unique here is that, in general, disinformation is always there in some corner of the internet. It's not completely new to us who follow social media. But what is different is that, in this case, there has been a greater reciprocity between what's happening in these obscure corners of the internet, whether it's social media or other media, and that being picked up by certain political figures and authorities. As a result of which, there is a greater amplification, what we call a spiral of amplification in social media, of information that would have been usually ignored, or wouldn't have gotten a lot of attention, I think. So as a result of which, what we are seeing is there is a kind of a mainstreaming of disinformation that is very unusual with this with this pandemic. So that's one of the reasons you see people continuing to advocate, say, malaria medication, anti-malaria medication as one solution, it persists. Or whether it is cell phone, 5G cell towers, spreading COVID-19, and that's one part, I think. I'm cognizant of the time, so I'll just say a couple of things about misinformation. On the misinformation side, and what we are learning is that increasingly these notions of folk remedies, in the absence of scientific consensus, remember, science is evolving. We didn't know anything about it until 8 months ago. And everything we know is in the last 8 or 9 months. And so therefore science evolves. Science works by consensus. Science is evolving and changing. Because of that gap in the way science works, people are confused, and there is that legitimate confusion. You said I should not wear face mask. Now you're telling me I should wear face mask. And what that has led to is there is a modicum of fact which is now exaggerated and filled in by people, whether you want to take garlic and prevent COVID-19 or drinking saline water or whatever. You can see a lot of that, and that is that's what we know. I think that's what we know. Just 2 points, and then I will keep quiet because I want others to jump in. Number one, I think this is the increasing attention we are paying to these things is like this, especially the impact of social media is like the proverbial, pony and the horse manure story, because everybody's on social media, it's people like us, and we see a lot of this on social media, therefore it is having a tremendously negative impact on people. The evidence is somewhat thin on that, so we have to be very cautious about it, number one. So not everybody's on Twitter. Regular people on the street are not always on Twitter, so it's people like us, so who are echoing this. And then the second thing is, there is good news and bad news. I think the good news is people are much smarter than we give them credit for. So in fact, they're continuing to comply with a range of public health recommendations, unlike the popular impression there. And it's a very small group of people, 20–30%, who are really openly not complying, who are getting increasingly a lot of attention, I think. So we have some choices we can make in the way we design our communication and policy and practice strategies to tackle this, I think. So.
Thank you so much for explaining that. I am really happy that you gave us that sort of opening to think about, well, what is it that we're talking about today. I also know Regina had a couple of examples on using data and misinterpreting data in particular. Let's do a couple more examples and then we'll move to the next question.
I can save those until later if you prefer.
Oh, okay, sure. Tori, do you want to lead us to the next one then?
Yeah, sure. So yeah, thank you, Vish, for kind of giving us that background. So we've heard a little bit about kind of why it's spreading or who's doing the spreading. It's a small group of people, right, that are actually kind of not complying and not maybe understanding the evidence. But I think why is there so much confusion and uncertainty? What is kind of contributing to a climate in which this spread of misinformation is happening? And I think that there are two kind of big areas. One is that it's hard to reach a scientific consensus, especially in the early days of researching this virus. And that the other thing is that it's actually really difficult to interpret data, especially for non-scientists. So Regina, do you want to kind of start us off there, say something about either of those?
Sure, happy to. I love this subject. I think one of the most important things that we should realize is that numbers, uncertainty, all of this, if it feels hard and we're getting it wrong, it's because it is hard. Our brains are not wired for numbers. They're not wired for uncertainty. We have a deeply embedded, hardwired ambiguity aversion, where study after study has shown that we continue to misinterpret these things. So that's the second point. I feel like we need humility then around that. We are all going to get it wrong when we're faced with data, especially as Vish was saying, 8-9 months ago, we had nothing on this. And uncertainty does go down over time, but we're still in the beginning stages of things. So the humility, I think, is important, realizing that we're making the best decisions that we can right now, and we're interpreting the best we can. That will change. We also need to check with the experts who specifically know how to interpret numbers and uncertainty, especially risk, this sort of thing. And that leads to what I think is a necessary emphasis on cost benefit, risk benefit, analyzing everything. So a number in isolation does nothing. You need the entire context. You need the expected outcomes, everything in there. So I have specific examples that I can give later if people are interested on how we're making these simple cognitive bias switches. But I think the humility of realizing that it is hard, we are going to get it wrong. We need to admit when we're wrong and go forward from that. And we need to learn how to make decisions in the face of uncertainty, which is the hardest thing to do as humans.
Matt, do you want to jump in on this?
Yeah, sure. So some really great points by Regina and Vish. I see a lot of intersections between the overviews too. And it's kind of like when I think of COVID and the misinformation we're seeing, it's almost like a perfect storm where we have this ambiguity of dealing with data. We're still learning about the virus. And then we live in this polarized climate politically. And also we have these social media influences. And I think it's important to realize how often we find ourselves in these filter bubbles. So a lot of times social media will have these algorithms that show people very different news feeds depending on their who they follow and their political identities. So you can have two people on Facebook, on Twitter, seeing very different things, which further exacerbates this problem. So I think that's important to be mindful too, is whether people use social media or even traditional media, they might be seeing very different news and very different interpretations of the news. And we know that a lot of people only read the news headline too before sharing it on social media or talking about it. So it's important to be mindful of all those components as well.
How do you see the media? So you mentioned social media has these algorithms that can kind of show different news feeds to different individuals, but how do you see the media maybe commonly misinterpreting data in such a way that the information that gets out there is actually not consistent or accurate based on the science?
So for me, I think, like Vish was saying at the beginning, it's not always necessarily misinformation. A lot of times it could be something that's more misleading or biased and focusing on only a part of the story. And then that part of the story is what people, what stays with people. So it's important for traditional media too, they are also motivated by financial incentives for getting more people to click on their articles and watch their programs. So sometimes I may only highlight a portion of the data and focus on something like there's a new treatment out, but it was only discovered that the treatment works in mice and not humans. So if only someone's reading the headline or just tunes in for a little bit, they say, oh, there's this new treatment. But then if they don't watch the whole thing, they might not see that it's only working in mice and it's still in the very early stages.
Could I add something to that? So I think it's important to distinguish between peer-reviewed studies and preprint studies. And this is something that the media they don't necessarily do. So peer-reviewed studies have been through, up to a year of expert reviews going over making sure that everything is okay. Preprints are exactly that. It's before it's been printed, before it's been peer-reviewed. So it's this is still a work in progress, but when the media journalists report them the same or give a a small nod to, oh, well, this is a preprint, and we're not really understanding that this is not peer reviewed. We're not understanding that this is just one thing that is likely to change by the time it goes through peer review and gets through to the end. So that's one thing that I wish people understood more and would ask specifically of authors in the media. Has this been peer reviewed, yes or no?
Just one additional point. I think this Matthew and Regina made excellent points. One addendum I would have is that it's just not the media, the journalists who are responsible for this. It is a scientific establishment. If you think about it, the eagerness with which we have been putting out preprints and non-peer reviewed material out there, with the anxiety that we need to get our information out, or the journals not being very careful. Remember, the number of articles have been withdrawn because the data are not available, the data are misleading. So it's just not the journalists, it is I think, even the scientists bear a large amount of responsibility for putting out information. I do a number of interviews with reporters. We have some data. We said we're not going to release it until it's going through the review process, but they're working very hard. They're doing a ton of stories every day, and it's very difficult for them to take every nuance unless they have some help from science communicators, that is, the scientific establishment and the journals. I think it's a larger ecosystem that is contributing to it. It's just not the reporters.
So I actually have a question about that because, all right, so there's motivation to get this stuff published that's intrinsic and pure. That is that we have a crisis, we want to address it now, so let's rush to the finish line to give people answers. But I also wonder, should we be concerned about special interest during a crisis? We've seen this happen in other public crises where there are special interests that infuse themselves at the right time because they see it as an opportunity for their own personal benefit. Do we think that that might be particularly salient in the COVID crisis and some of these data that are fraught with problems?
Yes, I think, it is a little naive, right? I mean, we all know this, the attendees on this workshop and the people on the panel, that for everybody in this, they have a point of view. To think that there is something that out there is bias-free is very naive, right? Everybody, right? Even though maybe as a scientist, I might like to think I'm bias-free, I'm not. I have my own agenda, right? I think that's not unusual to have that bias-free, but I think it's an important thing is, particularly in democracies like ours, I can't speak to totalitarian regimes, but particularly in democracies like ours, there is a self-correcting mechanism, right? There is, every time I publish a paper, I have to declare my interests, what are my declarations, that helps to a point. So somebody can say, hey, you're getting money from Sanofi or some of the pharmaceutical companies. So whatever you say on vaccines, I'm going to take it with a grain of salt, or the journalist can question that, I think. So it's not that there's not a bias, but in the recent COVID-19 case, we have seen that, when a couple of pharmaceutical companies were eager to send out a press release, they were immediately called on it, by the community, I think. So I don't want to minimize, because it's an important issue you raise, but I also want to say certainly there is a self-correcting mechanism there, I think.
Yeah, well, I'm so glad you mentioned that, because that is the purpose of the peer review process, right? And that speaks to the problems that we've already discussed of, the preprints that Regina mentioned. It's checks and balances in the scientific process, and when we try to skirt that process, that's where we have real big problems.
Do you mind if I add something to that, Taylor, and what you said, Vish? I think one of the most powerful cognitive biases or the special interests that we have is that we really want to find something that helps. And even if it's just a random blip in the data, we want to seize on that because we want this treatment to work. We want to present something. And there was not too long ago a press conference on a treatment that was given emergency approval. And the person who was reporting this gave a very dramatic statistic for increase in survival. And if you actually go back and look at the numbers behind it, the evidence is still strong, but much more mixed. And there was only one statistic that was pulled out and presented misleadingly. And so I understand that. You want to be able to show this is important. It's important to look at everything behind that and realize that we humans have a bias towards wanting to help and wanting things to work, even if it's just random noise.
So considering that sometimes we need to take scientific studies with a grain of salt, like with that in mind, can you guys speak to a little bit about what a scientific consensus is, how it's reached, and why we're seeing contradictory evidence, why we're seeing scientists disagree with one another, and how that's kind of playing into this uncertainty?
I can jump in right away. I know, Matt, if you want to, you raise this issue earlier too, and Regina too. So, to be very frank, this is such an interesting question in many ways, right? So, number one, consensus studies take a long time, and consensus for anything, on any subject, to build consensus takes years, sometimes decades, and we also know that consensus can fall apart by one new finding, right? For example, cholesterol and eggs is a great example of that, right? So we have villainized eggs for a long time, and then suddenly now we are saying, well, it's not a problem, right? So the way science works is that it's cumulative knowledge. So there are findings which are supported and there are findings which are not supported. But what we do is over a period of time, if the scientific findings are going in one direction, as everybody knows on this workshop, right? So coffee is a good example. Is coffee good for you? Is coffee bad for you? And as somebody who drinks coffee, I think it's good for you. But actually the scientific consensus is largely it is good for you. But the way there is an inherent conflict between how science works and how science is reported, right? The culture of science is it takes time, cumulatively, self-correcting mechanism. There are always negative findings, null findings, but over a period of time, we build that consensus. The culture of reporting is, I need to report something today. A journalist doesn't have time to go back and do a literature review and say, okay, but 5 weeks ago, we reported a story about coffee being very bad. Today, a new study has come out that coffee is good, right? Reporters don't do that. So there is an inherent conflict between culture of science and culture of journalism that creates this impression among people, can the scientists make up their mind? They're always changing their mind, right? And I think over a period of time, we can actually build that consensus among people. And there is very good evidence that people's opinions about certain topics like cardiovascular disease, tobacco, and cancer, there's a tremendous amount of commonality and overlap between scientific community and people. What you see with the COVID-19 is because all this science has been less than 8 months old, the consensus is not there. And that is leading to this confusion. And that's where, Regina's point about cognitive biases, because you want to fill in those gaps that people have. And that's where they are lending this idea of somehow that misleading information, and we're trying to make sense of it. So I think that's the challenge we are facing here in the context of COVID-19, because imagine we didn't know anything about it just a few months ago, 10 months ago. Entire scientific enterprise is focused on it in just a short, compressed period of time. And that's the reason we are seeing this confusion.
Matt, did you want to weigh in on that?
Yeah. I think Vish raised some really great points. And there's definitely a conflict between journalism and science. Just the processes are very different. They have different goals. So that's going to create some conflict sometimes. So I think it's a challenge for science communication overall is how do we best communicate science is an uncertain and cumulative and long process, and how do we best focus on the methods used in science and focus more on the method and the methodological practices that scientists use, and not so much emphasis on the results, because everyone wants to know, okay, what's the finding? But I think it's really important to also try to communicate how they came to this result, where they are as far as the scientific consensus and talking with other researchers. So as best we can, we need to really be mindful of focusing on the methods and the processes that we've used to come to these different conclusions. So again, it's going to be tricky if you, as a scientist, if you give this story to a reporter and they still just want to focus on the results. So I guess as best we can is try to highlight the importance of the methods and the methodological processes involved in knowing what we know and knowing how we know what we know.
I'm glad that you mentioned that, because I think it ties to the point that Vish was making about, you know, the studies on eggs or the studies on coffee, and being real, you know, the public being really frustrated with these inconsistencies in the science, but the inconsistencies are often explained by differences in methodology, and especially it's difficult to test things whenever you can't put people in a test tube, right? You can't necessarily tell them you have to live your life this way where you can only eat eggs or you can't. So it's very difficult in methodology to tease apart real situations. At least with COVID pandemic, we can put a virus in a laboratory setting, and we have some ways of rigorously testing methods of medication and treatment. So at least there's that going for us now. But like you guys are saying, it also takes time to accumulate evidence because studies have to be replicated. We need to be relying on a body of evidence, not just a single study.
One thing I feel like that's good about what Matt brought up, I really like that, is humans respond very well to stories. So if we can couch this in a story, and so when I talk about quantitative communication, I say you need to hit on 5 things: the numbers, what the results are, the evidence, how you actually got there. So telling the story of what's there, the uncertainty, which is an important part in there, how surprising the results are. Did this really change, or is this what we expected? And decision-making, being able to tie that back in there. And if you do that, you can get a whole story arc in there. And it's true, as Matt said, okay, you're going to get some journalists that are going to just want to jump to the end. But I feel like if we are asking the scientist and the scientists are giving these stories, then we have a better chance.
I mean, there is a, just to add to that, I mean, I completely agree with what both of them, Matt and Regina said. You know, a former postdoc of mine who's a faculty member at Minnesota used to say, it's not that people need science literacy, they need research literacy, you know, how research works, right? You know, how research changes. And that's a long-term problem, right? It's not, so we have to go back to schools and really build that, you know, from the beginning. In the short term, you know, one of the things that I find pretty frustrating is not in a negative way, but, you know, that we are not listening, you know, we are not doing good listening. You know, it also refers to the question that has come up. I think people are, there's so much going on in people's lives, you know, particularly if you don't have a lot of material resources, social resources to help yourself. We really need to listen to them, you know, understand where they are coming from. They are not that, they don't have the time, you know, if you have 3 kids at home who have different school schedules and you have one computer, you know, it's extremely difficult to pay attention to scientific articles and science stories or medical stories. You know, you're just trying to live your life. So somehow we need to really shift this entire paradigm to think about people, you know, where they are, what is their history, what is their culture, and understand and meet them where they are, rather than think of this as a one-way communications. You know, really, how do we make it a dialogue? How do we make it a community engagement process in communicating this about science, rather than to say, you know, people should pay attention to X, Y, and Z when they read a story. They just don't have the time. You know, so.
These are excellent points. Thank you. I can sense us kind of transitioning into where we want to spend the bulk of our time today, which is, all right, so what do we do? How do we communicate this effectively when we know we're not going to have a scientific consensus for months, years down the road? What can we do about communicating that within that uncertainty to the public? So let's kind of transition here, and maybe Rachel, you can put up our third poll question. We want to know what your biggest communication struggle has been. So where you are finding challenges in communicating with constituents around COVID. And then maybe let's start talking about what are some things that we can do? How can policymakers and public health officials present information accurately and credibly and transparently?
I guess the first thing I want to say was just to build off what Vish was saying, because I think it's a really crucial point as far as expressing empathy. I think that's one of the biggest things, is trying to see where people are coming from and treat them with respect, because one of the biggest ways to get people to not listen to you is to make them feel defensive or attacked. So as science communicators, or as anyone trying to communicate information, we want to be empathetic to where they're coming from and to make sure that they're feeling heard and to make sure they're not feeling attacked at all. So that's one of the biggest things I wanted to say right at the beginning. And I did see that question about how do you talk about the scientific consensus without making people feel attacked. And I think that's a really interesting point, because it's sometimes just saying, listening to the scientific consensus can feel like an attack, but I think also how you present it could be really important. So you can talk about other types of scientific consensus, such as how we know that smoking cigarettes can be bad for you and cause cancer. And this was something that was derived from scientific consensus. And again, just try to really highlight where that person's coming from, and to not be dismissive and just be like, well, it's science, and then end the conversation there. I think it'd be a lot more productive to have a conversation about how researchers have came to this conclusion about this process and how it's similar to other things that they've studied as well.
And empathize with the confusion and the mixed messages. It's not, it's understandable that people are confused, right?
Absolutely.
I mean, right, there is this kind of a meta approach, right? And then there is this micro approach. What I mean by that is, the micro approach is, how do you construct a scientific message, right? How do you, right? And Regina alluded to one of them, which is very powerful, the narratives, the stories, right? Or how do you correct a wrong belief if it is wrong, in the sense, you don't repeat it. We know that, right? When you're correcting a wrong fact, you don't repeat the fact, because you start saying that here is a wrong fact that people know, right? We know that from science, from evidence, because when you repeat a fact, then it still leaves a memory trace, even if you correct it, right? So we have some very good stories, exemplars. We have at the micro story construction level, we have some fairly good evidence on how to communicate, I think, But also, I think there is this kind of, and I don't know where you're going with this, Tori and Taylor, you can tell us, or you can stop me anytime. There is a meta way, how do you actually build that engagement, that dialogue, I want to say that expertise lies not just among scientists, not just among policymakers. Expertise lies in the community too, right? If you take community-based organizations, they're experts on their beneficiaries in their communities. People are experts in their lives. So how do we build that engaging dialogue? How do you engage them and tap into that expertise before we start developing solutions and dumping the solutions on them, right? I often say that I was trained how to collect data, analyze data, and write reports. I was never trained how to listen, so it's a kind of it's an acquired thing. I had to really train myself to listen to the community, acknowledge where the community is, and communities also, different sub-communities, right? Different racial and ethnic groups have different cultural understandings and experiences. It's just trying to really lay it out there and learn from them before we start thinking of developing solutions for them.
Vish, you're really speaking my language on community-based research and the values with that. Thank you for acknowledging, how do we start with kind of the motives of the people who have their own expertise to contribute. I want to look at the poll results. It looks like we had about half of people reported that they were most interested in, or said that the biggest communication struggle was about dismantling existing false beliefs. Second to that was pretty close second, balancing evidence recommendations with trade-offs in decision-making. So how do you balance those two things? And another person did report the lack of partnership with scientific experts. So what have we learned so far about dismantling these beliefs? I think we've already talked a bit about how we build empathy and are listening and learning and engaging with people in kind of a different way. How is that key to dismantling false beliefs?
I'll give a couple of examples, totally plagiarizing from Regina. Okay, so as if Regina is not in the room, so I think she can be more articulate about it than I am. There's one statement I said earlier, which is, how do you correct wrong beliefs, right, or wrong? And as I said, our science clearly shows you don't repeat the myth and then try to correct it, because by sheer repetition, you are actually leaving a memory trace in people, right? So if you look at my website, we created a dashboard with the help of the community, for the community. And in our dashboard, in our myths, we have a tab called myths and facts. And we say clearly, here is a myth and a wrong belief we want to correct, right? So we identify it's wrong in the beginning and then talk about it and how to correct it, right? So that's one, and there's a good science around it, it's not, right? And then the other is, of course, people's defense goes up, as a questioner so clearly asked, whenever you're actually, you're threatening their autonomy, so to speak. And that's where I think Regina's idea of, really talking through narratives or stories where you're minimizing reducing the counter arguments has been most effective. I will let Regina jump in here. I know she knows more about this than I do. The one thing I would say in terms of beliefs is that as scientists and communicators of science, we always deal with data. We talk about rational approach. People don't think in those terms. Emotions matter more than rational approach. It's not emotions versus rational approach or emotions versus facts. It's emotions with facts or facts with emotions, as you were saying earlier, Regina. So we have, again, very good science on how to communicate with emotions and narratives. I'll let you jump in here.
Vish, I think that's great. Thanks for reinforcing everything I'm saying. Daniel Kahneman, the Nobel-winning economist, has a great quote: "No one ever made a decision because of a number. They need a story." And I remember that when I'm helping people get there. A couple of weeks ago, I gave a talk about human-centered quantitative communication at Dana-Farber, and I was trying to put risk into perspective. And it's a little bit what you were saying, Vish, about the emotion part. And so I talked about, rather than giving numbers for the risk of dying, so I focused on Massachusetts during the first wave, the first COVID wave up until the end of May, numbers, whatever. I said, if you were under 65, the added risk of being in Massachusetts during that time with COVID coming, the added risk is if you were to go skydiving once every 3 weeks for a couple of months. The added risk of dying, catching and dying from COVID, if you're under 65, would be like going skydiving every 3 weeks for a couple of months. if you're 65 and older, it would be like going skydiving 10 times a day for 2.5 months during that time. So again, this is, I just focused on a particular thing, but I feel like that tells a story that says, okay, that there's a risk. There's always a risk of everything that we do. What sort of risk are you willing to take given who you are? And I think framing it in that way gets to an emotional sort of impact in a way that just numbers don't.
Such a good example.
Yeah, that was great. Yeah, Vision of Gina, really, really great points. And I'm glad we're staying with emotions because, again, I think this is one of the most important aspects of communicating science, and especially science that can be contentious sometimes. A few other strategies can be focusing on common identities. So whenever you're talking about someone and you're trying to connect with them, again, you don't want to alienate them if you're on different political perspectives or you have different identities. One thing is you can focus on common identities, such as if you both live in the same community. And this can be a really effective way to have your message and share it with other people, is to talk about how we're all in this together and we're all in this local community together. And that gives a framework to then connect with them on a more meaningful level. So that's one strategy. And then once you're talking with people, so again, I think it's also important to think about the different levels of communication. So if it's like a micro interaction, again, kind of what Vish was saying about micro versus more macro messaging. If you're having a one-on-one conversation, you're going to use different techniques than, you know, sharing a newsletter to lots of different people. But any sort of strategy, again, you don't want to make anyone feel defensive. So different strategies for different audiences are also important. And whenever you're having these conversations, it can be helpful to reframe the points you're trying to make in a way that the audience may be more receptive. So try again to see what they're concerned about and then reframe it in a way that's more receptive to them. And finally, one of the simplest but most important points, I think, for communicating science is it takes a lot of work and it can take a lot of time. And sometimes you have to repeat these steps. So a one-off conversation might not change someone's mind, or they might not get all what you're saying. Sometimes it does take repeated conversations to really make an impact.
There is a question. I'm sorry, go ahead.
No, I was going to move us. Go ahead and respond.
No, I thought there is a question from John Waldron, which is in Matthew's realm of expertise. I don't know whether you wanted to address that or not, you know, so.
You see, we are on the same page.
Okay.
Yes, thank you. Yes, I saw the question. We have a question from the audience. And in particular, I think what we can focus on is thinking about how we move away from, you know, one point and thinking about what the science actually shows and how that's related to our collective interests. So how can we, so this question is asking how someone can pivot whenever there's maybe values oriented toward one piece of solution proposals to something that is different and more focused on collective interest. How do we frame the message in a way that moves maybe away from individualistic values to more collective action?
Yeah, it's a great question. And I think it relates to some of what I've been saying about reframing your argument and trying to see what people are concerned about. And as far as mask wearing in particular, I mean, you can make an economic argument for why people should wear masks, right? If you're interested in opening up the economy and having these businesses thrive, you can say, well, mask wearing is going to be part of that. So really trying to see what they're concerned about and seeing how this is something that will benefit them as well and their interests too. So really trying to see where they're coming from with their political perspective and seeing how that fits in the framework of their own concerns.
Even in my local community recently, there was a local business that got shut down because they had to quarantine for multiple weeks. Maybe this sort of relates to Regina's point about stories.
I don't know if this relates directly, if this, John, will help answer that question. And this might be a little controversial, but I'm a big fan of the 80-20 rule. You know, this Pareto thing that you can get like 80% of your bang from 20% of your buck. And I was really fascinated to see what France did recently with their quarantines. So instead of having 14 days of self-isolation, they dropped it down to 7. And their reasoning was this. They found through studies that most people weren't doing 14 days anyway. And that most people, again, most people, not all, but most people were not contagious after 7 days anyway. So they realized that, okay, we're going to get the massive bulk of our benefit by going ahead and saying, okay, 7 days is enough. It would guarantee more compliance. 100% no, but 80% is often good enough. So I don't know how that translates exactly with mask wearing, but it feels it's a little bit of like, I hear you. I hear that you don't want to stay isolated for 14 days. We figured out that maybe you don't need to. If you can go ahead and do it for 14 days, great. If not, we're going to say 7 days and we're going to be strict about that.
Well, that also probably corresponds with the best practice that we've learned about highlighting whenever people are following, when there's a greater attention on social trends and norms, the prevalence of that behavior change, highlighting when people are doing the right thing.
Yeah, that's another thing I want to mention real quick. I think it is important that we focus on positive behaviors too. So often, again, there can be this bias that we focus on the negative aspects, or the people who are actively protesting against mask wearing, for example. But then that misses the point that most people are wearing masks and are supportive of this. So whenever we're communicating this, I think it is important to focus on the positive aspects of it too.
Yeah, absolutely. You know, there's also a question about vaccines or anti-vacciners. You know, so what we found very clearly, right, with the vaccines, if you look at childhood immunization, adult flu vaccine is a different issue. But if you look at childhood immunization, it's anywhere between high 70s to almost low 90s who are compliant, right? So it's really, you know, I was chairing this group for the National Vaccine Advisory Committee on vaccine confidence. And when we looked at the numbers, it was stunning. Almost everybody's complying, right? It is this really small group that is not complying, but that's very vocal about it. And they get the greatest share of voice in the communication ecosystem. And I said this publicly, that's a fringe group. It's a very small group that's really getting a lot of attention. And journalists have also realized that, that most people actually are complying with it, with vaccination or immunization. Same thing with public health mitigation measures. If you look at the numbers on the mitigation measures, that, you know, from our data, from the data from Pew and others, 70% are wearing masks, you know, 60 to 70%, depending on the numbers, said they will get the vaccines. People are washing their hands. People are actually maintaining their social distancing, right, or physical distancing. It's not that they're not doing it. It is just that we are not paying attention to this group of people are complying, and we are focusing attention on this very small group, which is very vocal, I think. So we need to really reframe it in terms of norms. And it's a normative actually to wear masks. It's normative actually to get vaccinated. And it is anti-normative, you know, it's a deviant behavior actually not to wear a mask and not to get vaccinated, I think. The challenge, of course, with COVID-19 is, you know, this notion of listening, as we were talking earlier. You know, the problem is you have to comply with 100% of the time, 100% of the people have to do it. And it's difficult for people, you know, this is what Regina was saying. It's difficult for people to do it. You can't take a penal approach and say, thou shalt do it, otherwise I'm going to punish you. It just ain't going to work. You know, it's only going to alienate people. We just have to understand what these challenges are and be a bit more forgiving and keep promoting this, I think, you know, so.
Do you mind, Vish, if I ask you a question? So what would be most effective for helping people have this positive peer pressure effect? You know, like to help point out that yes, 70%, 80%, 90% of the community is doing this, and help make that the norm. How do you craft that message to the tiny loud fraction?
So there have been some non-correction messages, actually, you know, in the context of alcohol, binge drinking as one example, right? You know, so I think what it is what it requires is, you know, suppose you ask people, simple experiment, any of us can do it. We go out and ask people, how many people do you think are wearing masks, right? You know, they will say only maybe 3 or 4, right? Whereas it's 7 out of 10 people are wearing masks, right? Instead of 3 out of 10. It is a kind of a norm correction. We can do that, you know, where we show people how often they're complying. In fact, you know, when I go, you know, along the river Charles here and running or walking, I see people 90% of the time complying with it. This one. The second is, of course, stories. I think, you know, we have legislators and other important policymakers on this workshop. Modeling matters. Modeling good behavior matters. If my own leader is not complying, then it's like giving me permission not to comply. But modeling positive behavior, you know, is a good thing, you know, and stories matter, I think, you know. So.
Awesome. Thank you guys so much for so much thoughtful talking points. I think that we're close to the end of time, and I just wanted to do a bit of a summary for everyone that's on. When we started talking about this, we started talking about, you know, what evidence do we have so far that misinformation is occurring, and what are its causes and consequences. One of the things that we really highlighted today is how the consensus process and scientific processes that are normal and routinized and part of quality, rigorous science are potentially contributing to misunderstandings because of public misunderstandings of the scientific process itself. And some of that is how it gets even represented in the media. Media wants to take snappy sound bites of information, and we need to make sure that the data that are represented are quality, high quality, based on peer review and multiple studies. And one of the things that I've picked up as well is, you know, how do we communicate those scientific processes to the public as a whole? Maybe even saying things that emphasize the scientific processes. What we know so far alludes to the fact that there's more to come, and this is an evolving process. Whenever we see misinformation that's presented, don't restate the misinformation, avoid that, but instead focus on what might be happening that is correct and what positive changes we're seeing. Avoid fatalism, because we don't want to just focus on the small proportion of people who are, you know, contributing to the chaos, but we want to find ways to leverage what makes us common, our common identities, our communities, the things we care about, our common values. How can we use that to bring people together? And in particular, we can use stories, as well as stories that have an emotional pull that explain the importance, explaining the risk, because numbers don't always convey risk in a way that everyone understands, but metaphors, as an example, might be a good way to convey the information in a way that resonates. Is there anything else that I'm missing, guys? I know that you guys have covered a lot. Any last words that you want to convey before people jump off?
The only thing I can say is public communication depends on transparency, credibility, and trust. If people get an impression that you're hiding something, it's going to go south pretty quickly. You know, it's really critical too. So.
Yes, thank you.
I just want to thank everyone for caring enough about science and communication, which are like infernally hard things. People come on a Friday afternoon to listen to academics talk about this. That means a lot to me.
Yeah, same here. Thank you all so much.
Thank you.
Yep. We'll be sharing the recording as well as another resource for you guys. There is a resource that summarizes some of these tips from the Societal Expert Action Network, which was funded in part by the National Academies of Sciences at the federal level. And they have some really great communication tips that summarize what we talked about today. So we'll send you guys a few more resources, and you know, please be in touch if there's anything that we can be doing to help you at the Research to Policy Collaboration. Thank you for your time today.